these technical difficulties. The world of Zoom, we're still all learning 3 years later. So thank you everyone for joining us today. We're so grateful for your continued partnership, especially with last year's 2 webinars that we've done on this topic. CHA is really committed to this work, especially around the Medicaid and CHIP program. And this topic is more timely now with some changes to the law from last year. Today, we are holding our 3rd webinar in our Medicaid redetermination series, where I'll be joined by my esteemed colleagues as we unveil CHA's Protect What's Precious campaign. Before we begin, as we do for most of these, we will start off with a little prayer and reflection. God of all peoples, you created us, all of us, from the depth of your love and delight in each one of our sisters and brothers. May your divine care enfold us in our poverty. May your grace soften our hearts, enlarge its concern for our neighbors in need, and open our hands to remove the barriers that keep everyone in our community from flourishing in fullness. Amen. And just a quick commercial for all of you. These prayers, as well as many of our other reflections, are available on our website. Our mission and my mission sponsorship colleagues work really hard on all of these, and so these prayers are available for you and many of your members and your organizations. And so please feel free to visit our website to get some of these prayers. This is part of our We Are Called campaign as well, a national initiative from CHA to really address issues related to health equity. And I think that this reflection prayer is very important as we think about the types of people, families, children affected by Medicaid redetermination as we begin this work. And so for today's presenters, I'm so glad to be joined by Lisa Smith and Brian Reardon, 2 of our vice presidents who have been very committed to this work and have put in a lot of resources and time in developing many of the things that we're going to be presenting to you today. Lisa Smith is based here in Washington, DC, and Brian is based out of our St. Louis office, and they both lead 2 of our departments that have jointly worked together to put together these resources. Before we even began to think about this process, I remember approaching Lisa about how this is going to be a big deal, really coming as part of the unwinding process. And she really gave us a lot of freedom working together with my colleagues in the communications department to put together these resources. And so without further ado, I'll turn it over to Lisa to walk us through and frame what's at stake with this process. Lisa, are you on?
I am. Thanks, Paulo. And really, thank you so much for spearheading this effort, identifying the need, and really working with our communications staff to develop all the resources that we're going to unveil today. It was through your leadership and recognition of the real detriment that this could be to low-income families across the country that has spurred us to move in this direction and develop these great resources, which I hope all of you will use. I think, as many of you know, state Medicaid programs across the country really provide health insurance coverage to over, I think we're close to 83 million or over 83 million with Medicaid alone for low-income, vulnerable men, women, and children across our country. And many of these folks are also patients of Catholic healthcare, and they live in our communities, whether around our hospitals, clinics, long-term care facilities, but they are the people that we engage with at the community level on a regular basis. So as you all know, during the COVID pandemic and public health emergency, under the federal law, states were required to provide what's called continuous coverage, which prevented anyone from losing their Medicaid coverage during the pandemic. However, that is coming to an end, and that continuous coverage protection, and every state will need to begin doing what's called redetermination, basically redetermining the eligibility of everyone, all 83 million individuals on the Medicaid program starting in April. So there are guidelines on how states out of the Department of Health and Human Services and how states have to do this, and in sections and lots of details. But Paulo recognized, and it's since been acknowledged in lots of newspaper articles, that there are millions of people who may unnecessarily lose their Medicaid coverage simply because of the lack of information, getting the word out that this redetermination of eligibility will be conducted by the state Medicaid agencies, and or state Medicaid agencies not having the most up-to-date information on contact information for Medicaid beneficiaries. So we really are starting with the basics, and have Paulo and the team in communications have developed resources to raise awareness, both for individuals to update their information with their state Medicaid agencies for contact, and also raise the awareness that they'll need to renew their Medicaid coverage. And really, as Catholic providers, we can play a very critical role in this to help ensure that our patients and low-income individuals in our communities don't lose this health insurance coverage unnecessarily. So let me turn it over to Brian to walk us through, or back to Paulo, whichever, to walk us through the resources we have.
Great, thanks, Lisa. And yes, Lisa is right. The many articles over the last couple of weeks have shown exactly the millions of people that could be at jeopardy of losing their Medicaid coverage. This article that we saw just yesterday from NPR talks about just how paperwork hurdles and the lack of being able to contact beneficiaries is something that HHS, the Department of Health and Human Services, is really concerned about. So again, our members play such a huge role in making the first contact with many of these beneficiaries as they walk into our facilities or through our community outreach. And so I'll turn it over now to Brian to walk us through and debut a lot of the resources that we've developed for all of you. And pardon any technical difficulties, but I think we will be shifting who gets to share the screen. So we'll try this out. And I guess I'll stop my share and turn it over to Brian.
Great, thanks, Paulo. And I will try to share here. So let's see if I can. Okay, so hopefully you will see the browser up. Obviously, this is the CHA website. So I'm just going to do a little show and tell, walk you through the toolkit. As you can see, it's linked here on this banner ad. You can always get to a lot of our resources by going to our focus areas. So I'm going to click on the Medicaid focus areas. And then again, we've got a series of resources. What I want to do is just walk through for a couple of minutes the resource page and preview what we've got available. So first of all, we got talking points. And again, I would encourage everybody. I see Karen on the phone, and I know Karen, we had talked about this among the communicators, but if you could, contact the communications team within your systems, make them aware of this. I think a lot of good information. And as we outlined, this is a really, really big issue. And so we do need help in getting this information disseminated in your facility. So the first thing we have is really talking points. Very simple, basic, one pager that you can email around. If you want to print it out for receptionists, registrars, that would be great, because again, this is just something that everybody should be aware of, particularly as they encounter or register Medicaid recipients. So we've got that. And then we've got a series of posters, both static print posters that you can do. And I'll just preview one of those. Again, this has got our logo on it, but we do have a version that you can actually go with without the CHA logo. If you just want to go ahead and brand it with your health system or hospitals or long-term care facilities logo there. And again, all you need to do is just make sure you get that. I'll kind of highlight this area. You want to make sure you download that PDF and then work with somebody in your communications department, a graphic designer, that through Adobe Acrobat, they can go ahead and add that. If you have any questions on that, feel free to email me. My colleague Jen Like is also on the phone or on the call here, and she's been instrumental in getting a lot of this information up. We also have a video. We recognize that a lot of waiting rooms, emergency departments are using video screens. So we have provided some slides that you can just put on your video screen. Again, you'll notice there's a QR code there, and that QR code will take you to, gonna jump around here, back to the main Medicaid page. So we do have links to everybody's, each state's Medicaid contact information. So that'll take you to this page here when you use the QR code on the actual posters and the displacing. So I just, again, wanted to kind of preview this. It's really easy to get to, all downloadable. You can also, if you want to order actual print and have them shipped, we do have in our store the ability to go ahead and order postcards, posters. They can be printed that you can go ahead through the store and order those, and those will be shipped out to you. So, Paul, I think that was a quick overview. The other thing I would say is, that not only is this a really important advocacy issue, but really this is also, from my perspective, a good PR position that we should be taking. As we talk about these issues, we know from some research we've done at CHA that when we get out front and talk about increasing access to care, that really does resonate with not only policymakers, but also the public. So again, I would encourage you to share this resource page with your communicators. We do have some social media graphics that can also be used to kind of highlight this, and you can use these images here that I've highlighting, download those, post those on your social media accounts, and then create a link back to the resource page. So I'll go ahead and stop sharing and turn it back to you, Paula.
Great, thanks, Brian. And as we mentioned, we're using this innovative way of getting information out through the use of a QR code. A lot of the time, many people who we interact with don't really have the time to really go through the whole spiel. And so this QR code directly links to a government website that allows people to find their state Medicaid agency for them to contact and really get to the beginnings of when states begin their redetermination processes. We've been told that the earlier that beneficiaries do these tasks, the easier it is as states begin the process of Medicaid unwinding. And we also know that in this day and age, cell phones are ubiquitous. Everyone has a smartphone that they can use to be able to click through. But we also have these print resources and these websites for people who actually don't have smartphones. Our website, our Medicaid Makes It Possible website, has been retooled to be a one-stop shop center for beneficiaries, as well as those who work in Catholic healthcare to get information. We posted past webinars, different podcasts, different articles that we've written through Catholic Health World. So it really is like a place that you can drive many of your colleagues to as you begin this work. And I'll go ahead and start sharing again, because I think that we still have a couple more tricks up our sleeve. And so aside from these new resources, we also maintain a listserv for our Medicaid Makes It Possible campaign. And we ask that if you'd like more information, a lot of the work that we do is not ending. As we unveil this campaign, we will continue to put together resources, especially educational webinars, different resources as they relate to the needs of our members. So if there are things here that you think that we can do to enhance this work, we ask for your recommendations. This is a partnership with all of you. And so on our Medicaid webpage, you'll see at the bottom of the screen a tool to sign up for email alerts as we continue this work. And so I think that is the end of our formal presentation piece. We welcome any questions that any of you all have. So you can either unmute yourself or chat it through the chat function. We're very informal here for this particular webinar. And before, as you all think of your questions, I would really like to thank my colleagues in the communications department, Jen Like and Josh Matejka, who really put together the creativity behind behind this, the language, the images, everything that they did, working collaboratively over these past couple of months, I think has been really great working with those two. And so let's take a look. I see a question from Maureen about these being in Spanish. Are we going to translate them in other languages? And if not, are we free to have them professionally translated? This is a good question. I think we are debuting them in Spanish, but we know that there are many different language communities that you all serve, and we will talk internally about how we can do these in other languages. But if you want to do them, feel free. I think that, again, these materials can be co-branded and customized. Brian, is there anything that I'm missing?
No, I think you covered it. Yeah, if you, again, download into Adobe and you can manipulate it. And if you want to just use that as a template and translate it, that's great.
Thanks, Maureen. Any other questions? Great.
And yes, Maureen, yes, if you have, if you translate into a particular language and want to send us that PDF, we can add that to the website. That'd be great. Thank you.
Great. As you all are still thinking of your questions, I invite Brian or Lisa to add anything else that we didn't discuss today. I know many of you might have questions about changes in the law. We are at the very beginning stages of thinking of another educational webinar. So if you have questions about what happened late last year, we will that is on deck for some of our future work.
Paul, I did post in the chat the Catholic Health World article that recently ran. I think provides a really nice overview of the issue and what we're doing. So if you get a chance to read that, that's link is in the chat.
Great. I think we wowed the crowd today. So I think we're really appreciative of your continued partnership. Many of you have been with us as we began this journey 1 year ago, but we know that the work is not done. There's still a lot of work ahead of us, but I think that starting with our Protect What's Precious campaign, I think we've laid the groundwork for making sure that anyone who accesses Catholic healthcare and really the communities that we all serve can begin the process of securing their Medicaid coverage. And so the formal webinar is ended, but we do invite you all, if you'd like to stay, we would like to play the message from Sister Mary, really debuting this campaign. So Brian, do you want to do that, or did you want me to do that?
If you have it queued up, go ahead. Otherwise, I can.
I actually don't have it queued up.
Okay, so let me let me go back to the Medicaid page and I will share. Okay, so all right, let me go ahead and share my screen, get this playing.
Brian, I don't know, can anyone else hear? Did you share the sound?
There's the audio.
Sorry about that. Yeah,
From
so
my
we
end
didn't
here.
get the audio to come through. Why don't I do this? Why don't I go ahead and put that in the chat, and then if folks want to watch that, it probably come through probably a little clearer if people watch it rather than through the Zoom call. I know sometimes so I'm going to go ahead and put the link in chat. Stop sharing.
Great, thanks, Brian. And again, please feel free to utilize these resources. We appreciate any feedback. On behalf of Sister Mary and everyone here at CHA, we thank you for helping us protect, coverage for our Medicaid beneficiaries as we continue this year. Thank you, everyone, and we look forward to collaborating.